In this video, we're going to continue our discussion of the lower extremity, talking about the leg and the knee joint. This is a continuation of a video previously made about the foot and the ankle. You can find the link for that video at the end of this one or in the description below. So here we're going to talk about the leg. The leg, as you can see, is composed of two bones. There's going to be the tibia right here, which is the bigger bone of the two, and then there's going to be the fibula over here on the lateral side. This is reminiscent of what we see in the forearm of the upper extremity as well, which is composed of two bones, the radius and the ulna. Now we see the same pattern repeating itself here in the leg, tibia and fibula. The fibula is off to the lateral side, like we said before, and the tibia is the one that we see here. Now, if we look at the leg in a human being, what is it that we're going to see? So with this, we just want to demonstrate what the tibia and fibula, what the surface anatomy of the tibia and fibula are. So right here at this bump that you see on the anterior aspect of my leg, that's my tibial tuberosity. This is my patella. When we look at the actual leg itself, right here on this medial side, this is straight up bone directly deep to my skin. Okay? So this is the same as this surface of the tibia right here. Okay, this is the medial surface of the tibia. And then you see that there's a sharp edge directly on the anterior side. And on the other side of that anterior side, if I hit there, it's not bone directly beneath my skin. This is massive muscle over here, which sits right in between this tibia and the fibula on the lateral face of this tibia. Okay, those muscles in there are going to be all the muscles of the anterior compartment of the leg, which are your dorsiflexors of the ankle and the extensors of the toes. The tibialis anterior, the extensor hallucis longus, extensor digitorum longus, and the fibularis tertius. All the way on this lateral side over here, you're going to have the lateral compartment muscles that align directly over the fibula. And you can feel for your fibular head, which will be this bony mass right over here directly on the lateral side of this knee joint. Okay? Don't get that confused with this bump right here that is directly lateral to the tibial tuberosity. This bump right here is actually going to be known as Gerdy's tubercle, which we can talk about in more detail in a future discussion. But Gerdy's tubercle is essentially going to be a small mass of an extension of bone right around this area on the lateral condyle of the tibia, and that is going to receive the iliotibial tract, also known as the IT band. So you can see the medial surface of that tibia is this surface that we have right here, okay? And this is known colloquially as your shin. When we look distally, we see that the tibia and the fibula form the two malleoli, the lateral and medial malleolus, which then grip on the talus to form the ankle joint. Another thing I want to point out about this area that was not mentioned in the ankle video, but is definitely applicable to this one, is that there are two joints being formed between the tibia and the fibula. On the distal end, we can see that the tibia and the fibula both fit together. The tibia has what's known as a fibular notch, and the fibula fits right into that notch. This is known as your distal tibio-fibular joint, which is in contrast to your proximal tibio-fibular joint. Your proximal tibio-fibular joint is going to be the joining between the tibia and the fibula at this proximal end closer to the knee. And you can see how the head of the fibula fits into another small fibular notch that is directly posterior and slightly inferior to the lateral condyle of the tibia. That's going to form your proximal tib-fib joint, or your tibio-fibular joint. Another thing that's joining these two bones together is a thick, tough, fibrous sheet that runs right in between the shafts of both of these bones. Now, this is something that is very deep inside of the leg. You have to dissect through all the compartments, through all the layers of the posterior compartment to reach it, or you could dissect all the muscles from the anterior compartment to reach it. The point is that it's basically the deepest structure of the leg, and it's a tough sheet that connects the shaft of the fibula to the tibia. This is known as your interosseous membrane. Again, this is something that we also saw in the upper extremity when we studied the forearm. So the interosseous membrane is going to connect these two bones together, at least the long shafts of them. Now, we talked about We talked about the distal end, the proximal end. Let's also take note of what's happening over here. So you can see that directly anterior on the proximal end of the tibia is this very rough patch of bone right here. This is known as your tibial tuberosity. This serves as the attachment site for a tendon that is essentially formed right around here by the four muscles that lie on this anterior compartment of the thigh. These four muscles come together to form a thick tendon, and then that tendon basically runs into the patella, or the patella is embedded inside of that tendon, and then the rest of it goes to then attach and insert onto this tibial tuberosity. I'm talking about your quadriceps muscle, which forms your quadriceps tendon, which forms the patellar ligament, which is ultimately what attaches to the tibial tuberosity. So that whenever these muscles of the anterior thigh contract, right, the quadriceps muscles specifically, when they contract, they're going to pull this tibial tuberosity anteriorly like so, okay? So that movement from this angle is going to look like this. That is knee extension, okay? So if I'm starting again from a middle position here, when my tibia gets pulled and moves anteriorly like this, that's known as knee extension. The opposite of that would be knee flexion. Knee flexion is gonna pull the tibia posteriorly like this. So if knee extension is being produced by muscles that lie on this anterior side of the thigh, then knee extension is going to happen by muscles that are lying on this posterior aspect of the thigh, right? And they cross the knee joint posteriorly to then pull the tibia and the fibula posteriorly like this into knee flexion, okay? So what did we just discuss? We just discussed this attachment site right here and the gross movements that the knee joint is responsible for. I say gross movements, right? These are the big movements. A lot of joints, or all joints, have very small movements that also occur at them, okay? Now, if you want to learn more about those smaller movements that happen at the knee joint, I have a completely different video on the kinematics of the knee joint that I will link at the end of this video as well. Anyway, let's continue our discussion with the gross movements, extension and flexion. This is what classifies the knee joint as a hinge joint, okay? Because it only has this one degree of freedom. It only travels through this one plane, okay, which will be your sagittal plane, all right? That's knee flexion and knee extension. Now let's look more at the structure of what's making up the knee joint here. If we look more closely at the inside of the knee joint, what we see, let me pull up a closer view. If we take a closer look at this knee joint here, right, what we see when we look at the tibia directly from an anterior view is that there's these two little bumps right here in the middle. This is the intercondylar eminence of the tibial plateau. So this whole shelf-like table right here is known as the tibial plateau, okay? And it has those intercondylar eminences right there in the middle, okay? When we look at the top of this tibial plateau like this, what we can see is that, let me get the light at a right angle. So what we can see is that there's these two concave surfaces on either side that basically allow the convex surfaces of the femur to then fit onto there, okay? So they fit on like so, all right? Now, even from this view, from this skeletal model, you can appreciate that the amount of concavity that there is to this tibial plateau is really not much. It's definitely not as much as how convex the femoral head is. Does that make sense? So it basically is like, it's not cupping the femoral head as well as it could be, okay? This is what we see when we look at the skeletal model. However, in the actual human body, this is not the case. Why? Because there's, how should I say, there's structures that help out with this. Fibrocartilaginous structures that help out with this, specifically known as the menisci, the lateral meniscus and the medial meniscus, right? So if we're looking from this view, from this anterior view, our lateral meniscus is going to lie on this lateral condyle of the tibia here, and our medial meniscus is going to sit right here. And each one of those menisci basically add more concavity to it, because those menisci themselves also have that concavity to them, which basically increases the amount of surface area contact that is between the femur and the tibia plus the menisci, okay? So that's the role that the menisci serve. They basically increase the amount of articulation between the femur and the tibia, okay? So it increases the amount of contact between the two to add some support and stability. Now, looking at this femur, at the distal end of the femur, we see that the femur has these huge condyles, this huge medial condyle, this huge lateral condyle over here, and in between the two is what's known as the intercondylar fossa. All right, a fossa is a depression on bone. So this is the intercondylar fossa. You could also see it very well from the posterior view. Okay, the intercondylar fossa is going to house two very important ligaments known as the ACL and the PCL, the anterior cruciate ligament and the posterior cruciate ligament. So let's go into the discussion now on the board to see more about these ligaments. So over here, we're taking a look at the anterior view of the femur and the tibia, and we're looking specifically at this ACL and PCL. So what I'm trying to point out to you is how these two ligaments are related to each other, and this is also going to show us exactly what kind of tensile forces they resist. So first of all, let's take into consideration the fact that this is the lateral side and this is the medial side. And then we're looking at it from an anterior view, right? So anterior is coming at you and posterior is going into the board, okay? So if this is the lateral side, that means that this right here, this part of the femur is my lateral condyle of the femur, right? This is the lateral condyle of the femur over here. And what you can see is that the ACL is attaching to that lateral condyle of the femur inside of this intercondylar fossa, and it's going to run anteriorly. So it's running out towards us in the board to then attach on a location of the tibia that is more anterior than where the PCL is attaching, because the PCL is going into the board. It's going posteriorly to attach on a site that's more posterior on the intercondylar eminence of this tibial plateau. Okay, so the ACL is coming from the lateral condyle and going out to attach on the anterior side of the tibia, and the PCL is attaching to the medial condyle, to then run posteriorly to insert on a more posterior location on the tibia. Okay, and so that's how those two are crossing each other. Another thing that a lot of people use, that I've seen people use to try to remember how these two structures cross each other, is basically by taking their fingers, right, and then crossing the second digit over the first digit like so. Okay, so no matter what leg you're looking at, whether I'm looking at my left leg or my right leg, on my left leg, if I cross over like this, I'm showing how the ACL in front, right, more anterior, is coming from the lateral side, right, coming from the lateral condyle, because this is my left leg I'm looking at on my left hand. Whereas the PCL is coming from this medial condyle of the femur and running posteriorly. Okay, and the same thing happens if I do it on my right side. So right leg is going to have my ACL coming from my lateral condyle, and then my PCL coming from this medial condyle running posteriorly like so. Okay, so that's one way you can think about those two things. Another thing I would add to this is just a quick mnemonic device, which is known as LAMP, L-A-M-P, right? Lateral condyle for ACL, medial condyle for PCL. That's how you can remember that as well. Now let's take a look at these cruciate ligaments from a different angle. So from this view now, we are taking a look at a view of a right leg, a right tibia and femur from the medial aspect, okay? So that would be as if I'm standing like this and I have my right leg right here like this, and I'm looking in from the medial side, okay? So this is going to be anterior, this is going to be posterior. You see that the patella is right here on the anterior side. And what we can see from this view is how the ACL and the PCL basically cross over each other from this view, right? So we can see that the ACL is starting more posteriorly on the femur, but then crosses anteriorly to attach onto the tibia, whereas the PCL starts anterior on the femur and runs posteriorly to attach onto that side of the tibia. And so you can see that they cross each other from this view and also from the anterior view, right? So this is where the word cruciate comes from. Cruciate means to cross. right? So this is your anterior cruciate ligament and your posterior cruciate ligament. While we're here, we can then also take this view to appreciate the kind of tensile forces that each one of these ligaments resist. So the ACL is going to resist any kind of force that is essentially going to try to pull this femur and this tibia away from each other like this, right? So the ACL is basic. So if I grab the tibia and I pull the tibia forward like this, right? You can see how that's going to put tension on this ACL. Not on the PCL. The PCL is actually going to become lax, right? Because both these ends will come closer together. But the ACL, both of these ends are going to be pulled further apart. This is known as anterior. This is anterior translation, right? Anterior translation of the tibia. That's the kind of movement that you're doing there. Realize that anterior translation of the tibia will put the same amount of tensile force on this ACL as posterior translation of the femur, right? You see that? So realize that both of these forces going in opposite directions would both be putting their own tensile force on the ACL. So the ACL is essentially resisting anterior translation of the tibia, which can also be thought of as posterior translation. Well, I put transition over here, but translation of the femur, okay? And likewise, the opposite of that, let me put this in red. The opposite of that would be for the PCL. The PCL is going to resist, right, posterior translation of the tibia, right? Whereas that is also the same thing as is applying the same tensile force as anterior translation of the femur. All right, anterior translation of the femur. Okay, so that's what the PCL is going to do, right? So these are the forces that they resist, and from this you can now see where the clinical tests of the anterior and posterior draw tests come from. Okay, so the anterior draw test is essentially testing to see if there's an injury to the ACL. The way you would do that is by grabbing onto the tibia, putting your fingers on the posterior aspect of the tibia as you put your thumbs right on the femur on a completely extended leg, and then you basically pull the tibia forward or anteriorly as you're keeping the femur pressed down with your thumb. And if you feel that one side has more laxity than the other, one leg has more laxity than the other, then you may have a tear of your cruciate ligament on that side. Unless, of course, you have bilateral ACL tears, which I don't imagine is that common, but I'm sure it has happened to some unlucky soul out there. That sucks. So that's how you basically test for the ACL. The posterior draw test would be the same thing for the PCL. Okay, so that's the discussion about ACL and PCL, the cruciate ligaments of the knee. Now that we've seen how these anterior and posterior cruciate ligaments are structured and how they contribute to the overall stability of the knee joint, we can now start to talk about the medial and lateral collateral ligaments. So the medial and lateral collateral ligaments, they're called collateral because they run on the medial and lateral sides, right? The collateral sides of the joint, okay? Similar to the collateral ligaments that we saw in the ankle. So we're going to have a medial collateral and a lateral collateral ligament. Now, before I start discussing that, let me discuss the concept of the joint capsule. The joint capsule around the knee joint, it's around most joints, especially huge gross movement joints such as the knee joint. It's going to have one of these ligaments built into the capsule, which is known as an intracapsular ligament. And the other one, the lateral collateral ligament, is going to be an extracapsular ligament. That means that when you dissect on the human body, you can clearly distinguish the lateral collateral ligament from the rest of the knee joint capsule. But you cannot clearly distinguish the medial collateral ligament from the rest of the joint capsule. So just keep this in mind if you have a cadaveric dissection component to your human anatomy course. Now, in terms of the function that these ligaments serve, all ligaments essentially check joints. They make sure that there's no excessive movements at joints, right? So we talked about anterior and posterior translation of the tibia and the femur in relation to the ACL and the PCL. The collateral ligaments are going to resist what's known as varus and valgus forces across the knee joint. So let's go into a discussion about what those things are. So right now we're looking at this lower extremity. This is going to be a right lower extremity. Okay, look at the foot, look at the tibia, the fibula out here on the lateral side. That's your knee, and this is your femur. So let's take a look at what's happening at this knee joint. Notice how I can move the femur, right? Like this. So there's a little bit of play at the knee joint in terms of this lateral and medial axis. If I have a force, for example, let's say somebody hits you with a hockey stick on the outside of your leg, or the outside of your knee, it's going to impact the knee right here. And look at what's happening to these two bones, right, when that happens, okay? Force comes out here, and what happens? When the force comes out here and hits on the knee joint this angle over here gets larger, right? So if you have a ligament that's running on this medial side right here, this medial collateral ligament is going to experience that tensile force whenever you come in with a force that's hitting on the outside like this. This is known as a valgus force or a valgus stress to the knee, okay? So the medial collateral ligaments resist the valgus stress to the knee, okay? Likewise, on the opposite side, if I hit over here, then it's going to cause the same, it's going to cause the same amount of movement. I can't show you too much on this model, but it's very small and slight, but that's known as a varus force or a varus stress. And likewise, we can see how the lateral collateral ligament, which you can distinguish from the joint capsule, is going to be running from this lateral femoral condyle to the fibular head. And that's the guy who's going to be receiving that tensile force whenever you come in with the varus force from this side. So just thinking about how most injuries happen, we can see that it's most likely to be exposed to a valgus force since most forces hit our knee from the outside rather than the inside. And those are the exact ligaments that would be affected in either case. So that is a discussion that we had today about the leg and the knee. If you like this video, hit the like button. If you want to be alerted to future videos, hit the subscribe button, and I'll see you guys next time.